Democrats are saying, I don't want to fund a government that doubles people's healthcare costs. Republicans trying to say this is to fund healthcare for undocumented immigrants is really just a lie.
I'm going to have a lot of complaints for Republicans here coming up, but I do want to shout out Alabama's U.S. senators. They co-sponsored legislation. This was a month ago, right? So it was so that this wouldn't happen. And Democrats have done similar things when they have been in power, right? When you are the party in power, you do not want the government to be shut down because government shutdowns are typically, not always, but typically blamed on the party in power. And so when we have had, there have been occasions where Democrats have introduced legislations to stop government shutdowns, which would continue funding the government like on a 2-week basis by just continuing to have CRs, continuing resolutions, when other budget measures are not approved. I think Democrats have tried to do that in the past, and now a month ago, because Republicans didn't want this egg on their face, they tried to do this. And so the legislation was introduced about a month ago by Senator James Langford, Republican of Oklahoma. The legislation would prevent the federal government from shutting down in the scenario that Congress does not enact all 12 required annual appropriations bills on time by triggering an automatic rolling 2-week continuing resolution to maintain funding at the previous fiscal year's levels. I'm reading right now some reporting by Alex Jobin in the Alabama Political Reporter. Alex does great work. You should definitely read his stuff when it comes up on the Alabama Political Reporter. While the CR is in place, while these continuing resolutions have been triggered by the Prevent Government Shutdowns Act of 2025, members of Congress would be required to stay in Washington, D.C. until the federal budget is complete, with no access to taxpayer-funded travel, extended recesses, or official trips abroad. Those same travel restrictions would also apply to congressional staff and officials from the White House Office of Management and Budget. Additionally, the terms of the CR would require legislators to meet daily, including on weekends, with only budget-related votes being held on the floor until all appropriations bills or a long-term CR are passed. And so when Republicans were in power, they didn't want to pass, any of these, types of legislations, or when Democrats had the Senate. Wait a second, hold on. Yeah, when Democrats had the Senate, Republicans wanted to pass this, Democrats didn't. And now Republicans hold the Senate and they want to pass it and Democrats don't, because Democrats feel like they have some amount of leverage right now. And they do, and they've got to really, and so now I'm going to talk about that. But what I hope is, I do hope, and we're coming up on the midterms, coming up in 2026, I hope that there is a real genuine interest from both some Republicans and some Democrats to stop this, because most governments don't have this thing, right? I mean, you look at governments from all across the world and like government shutdowns, that's just not a thing that happens in other places. And so it's like a uniquely kind of indication of dysfunction of the American government that we have this. And so I do hope that after this episode is over, we can agree to something like this, because that's needed, because government employees, military service members, and the American people who rely on these services should not be used, generally speaking, as pawns in, political games and stuff. And so, it is funny seeing Republicans now making that argument that, we don't want to shut down the government over policy disagreements, when Republicans have been the ones doing that for, that's been basically exclusively why the government has shut down in the past, is because Republicans have policy disagreements with the Democrats. And so now Democrats are doing it and Republicans are saying, oh, well, we don't need to do that. Okay, so I did want to mention that because I thought that was really interesting, and I hope something like that does get passed in the future. But Democrats do have a lot of leverage, because what they are asking for is for the Republicans not to increase health care costs of Americans, which is what would happen at the end of this year if Republicans' budget stays the way that it is. And, and look, it's not unreasonable that Democrats are saying, I don't want to fund a government that doubles people's health care costs, right? That's not unreasonable. And so Republicans are trying to say that, oh, well, this is to fund health care for undocumented immigrants. And that is, it really is, there are a lot of things that, you can kind of massage and stuff. And this is really just a lie. It is just a lie. Because there's a law in place that was signed by Ronald Reagan that says when a hospital gets somebody who is, unconscious, is having emergency medical needs, they must treat them. Okay? And I think if you ask people about that, they say that's good. They say it's good that we live in a country where if you are unconscious and having a heart attack, the doctors will just begin trying to save your life instead of rummaging through your pockets to try to take money or look at your papers or see if you deserve treatment. If you have a heart attack, you should just get treatment. Now, it's bad that we live in a country where after that is done, you might become bankrupt and the hospital system is going to try to, squeeze you dry of all of your money. But I do think it is better than not that we live in a country where if you are dying, hospitals have to treat you. I think that's good. And so that does mean that immigrants are going to get treated at our hospitals, including, yes, undocumented immigrants. But that law is not even, the Republicans are not trying to repeal that law. What the Republicans' budget does is it says that hospitals that treat people, if one of those people that they are required to treat is an undocumented immigrant, then the federal government is not going to reimburse that treatment through Medicaid, even though the federal government is requiring the hospital to give the care. The federal government is then not going to pay for the care that they require the hospital to provide. And so what does that mean? That means that the hospital is going to have to try to find try to fill those costs somewhere else. They're going to have to charge Blue Cross Blue Shield more money on everybody else's health insurance. They're going to have to do something to make up that cost because they're not just going to eat the costs. And in a lot of cases, especially for rural hospitals, they can't. And so this is obviously going to put more rural hospitals in danger of closure. We've seen dozens and dozens of rural hospitals across the country close because states are refusing to expand Medicaid. We've seen like a dozen rural hospitals close in Alabama because we haven't expanded Medicaid. And so that's what this is. That's what part of and also that reimbursement for the legally required care of an undocumented immigrant by the federal government. It is just to remind. I just want to reiterate this so that if people are coming in on a part of the conversation, that they're not misunderstanding me. The federal government requires hospitals to give emergency treatment regardless of anything. And so Republicans want to say, if the person who gets that treatment is an undocumented immigrant who cannot pay, then the federal government is not going to reimburse the hospital, while still making the hospital give the care. And also, that care that is issued to undocumented immigrants is like a fraction of a percent of the total things that we're talking about. The vast majority of the dollars in dispute are going to native-born Americans or lawfully present immigrants. And states that have not expanded Medicaid are most at risk. They are the most likely to have people who will suffer because of the Republicans' health care plan. We're in Alabama. Let's look at the numbers for Alabama. Alabama Arise has a really good fact sheet about this. They say that the enhanced advance premium tax credits that have made health insurance more affordable for hundreds of thousands of Alabamians are set to expire at the end of 2025. If Congress doesn't act, premiums for families, small business owners, and people who buy their own insurance will skyrocket, forcing many to give up their high-quality health coverage and leaving many of them uninsured. So what's at stake? 477,838 Alabamians are enrolled in marketplace coverage as of May 2025. 98% of those people receive those enhanced advanced premium tax credits to help afford their monthly premiums. The average marketplace premium in Alabama will increase. The average. That means, what does average mean? That means 50% of people will see increases higher than this, and 50% of people will receive increases lower than this. The average marketplace premium in Alabama will increase by 93%. That's nearly double the cost for working families already struggling to make ends meet. 130,000 Alabamians could lose health insurance if the enhanced subsidies expire. This loss of health coverage would cost Alabama $1.1 billion in economic activity and 10,000 jobs in 2026. This is not like this is a far off sort of thing. These tax credits are expiring at the end of 2025, and that's what's going to happen next year. In like 60 days. Who would be hit the hardest? Small business owners and self-employed Alabamians, more than 65,000 of whom receive their health coverage through the marketplace. Older adults and families with lower incomes would bear the brunt of skyrocketing premiums. For example, a 60-year-old Alabama couple making $82,000 would see their annual premiums for a benchmark plan increase. This is wild. And Republicans want to do this. A 60-year-old Alabama couple making $82,000 would see their annual premiums for a benchmark plan increase from $6,970. That's already a lot of money to pay, right? If you're 60 years old, you're making $82,000. If you're 62 years old and the two of you are only making $82,000, guess what? You probably don't have a whole lot of money for retirement. You're probably going to be working into your 70s. And so $7,000 a year is already a lot. That's like 10% of your income going to healthcare. But that's what it is now. That's the affordable version. Under the Republican plan, it would increase to more than $27,000 to $27,276. That is, that's crazy. Households earning as little as $15,000 per year for an individual, or $32,000 per year for a family of four, could be priced out of coverage altogether. And so the Democrats are saying, look, we are not going to fund a government that increases healthcare costs for 60-year-old couples making $80,000 a year by 4 times. We're just not going to sign on to that. And I think that's not unreasonable. That's not unreasonable. And so, look, that's what this is over. And don't let people trick you into anything else, into believing anything else. This is to protect the tax cuts for the ultra wealthy so that we don't have to give health care to poor and working people. That is fundamentally what we're about, what this is happening, what this is going on here. Hey, 5 seconds. Just wanted to say that this is only possible because of our donors. If you want to see more of this, then consider donating yourself at tvlr.fm/donate. We got a caller on the line from a 256 area code. Let's bring them on the air. 256 area code. What's your name? Where are you calling from?
It's Dwayne, Jacob, Adam.
Dwayne, thanks for calling in. What's on your mind?
Yes. Well, the shutdown has caused a problem that's not unlike the problem that I dealt with to try to help with the bedridden when the hospitals closed. Sunday, when the shutdown took place, another thing occurred, y'all. And that was that senior citizens will no longer receive checks in the mail. Now, things were supposed to be set in place to saying that they would help these persons. The shutdown took a considerable amount of Social Security workers from these places that already didn't have enough, that were already too far away. And there is a likely chance between there being between 50 and 250 people across the state that will just not know what happened and not get a check in the mail. Are you following me there?
Right.
And the only, and this is my thinking is I wasn't there when these persons were kicked out of the mental hospitals, but I am alive today and able to tell you on the radio that this is potential to happen. And in North Alabama, the counties most at risk, that would be the persons over 85 years old that are single, that are not tech savvy, are in the rural areas of DeKalb, Marshall, and Morgan County. And I'm asking any church members that may have not seen an elderly person, or you just see them, just to make sure that they've got the number as to where to call to get things done if you didn't do anything else. Give them a phone call. Have you got me? Because they will have nothing. They may not even have a way to get anywhere, to have a card, to make a bank account. They may not have a family. My family, myself, if I was 20 years older, y'all, my father died in the line of duty as he was the enforcement director of the alcohol beverage control, y'all, and in pursuit, he hit power lines trying to chase someone running. And my grandpa and uncle died as a result of working in the logwoods and trees hitting them. So it would be very easy for me to be in that same position, not know what happened, and money has suddenly not come, and the current administration and state doing nothing about it.
Right.
And like you were saying, it's the persons in these situations and just the regular working people that are being harmed. And here's my thing. I just really don't see, if Tuberville were to be governor, that he will do anything except extend this and do what the Trump administration wants. So that's something to keep on your minds there, guys. And anyway, that's the main things that I was wanting to get across. And remember that Friday, HBO Max, the Alabama Solution, it will be on. And I understand that, I believe it's the 18th, there'll be some showings at the theaters in Huntsville.
Yes. Yeah,
really looking forward to that, and I appreciate you tipping us off about that some time ago and putting it on our radar.
Yeah, appreciate it, Dwayne. Thanks for the call. If
you
want to get where he is,
go see it. Hey, take care.
Yeah, if you want to get where he is, the phone number is 844-899-TVLR, 844-899-8857. Give us a call. Let us know what you think about the shutdown. Let us know what you think about what we're saying about it, because I know that some of the stations that we are on, it's going to be what we're saying is going to be running pretty counter to what some of the messaging is. But, you can go and look this stuff up yourself, right? You can go and look what I'm saying up and verify it. And I hope that you do. And I hope that you ask people who are telling you otherwise, why they're not telling you what I'm telling you.
Yeah, absolutely. And I was just going to share a little bit of what AFL-CIO put out recently about this, because they talk about how they are definitely asking to fix this healthcare crisis. They're definitely asking to end this shutdown. And I'll just quote a little bit from AFL-CIO President Liz Shuler. The federal government is shutting down right now because President Trump and his administration chose chaos and pain over responsible governing. Now, countless jobs, the essential government services we all rely on, and the economy powered by a workforce are in jeopardy, all because the administration wants to take one more swing at wrecking the Affordable Care Act and throwing working people off our health care. So, they go on to talk about how there are hundreds of thousands of federal workers right now who are impacted. And there are federal contractors, including custodians, cafeteria workers, folks like that who do not have the assurance of back pay, right? So Washington politicians are not the ones really at risk. It's regular working people who are impacted. Folks like, our caller Dwayne just mentioned, people who are elderly, people who don't have strong support systems, people who are living on the margins, and we depend on these government services. We depend on these public services. We've already seen attacks on federal workers throughout, the last 6 months or so, right? We've had federal workers being fired, and then some of them rehired, and then some of them fired again. They've lost their union rights. They've lost their contracts, their voice on the job. And, it's just sickening to see so many working people used as pawns for these games. And like you mentioned earlier, to recognize how this is really a wealth transfer. We're going to take from the poorest to give to the richest. Now, what kind of sense does that make? Even if you don't care about the poor folks, shouldn't you want a thriving economy? I mean, don't you recognize that when you take from people, they're not going to be able to spend at your stores, right? They're not going to be able to shop in our economy. People who are already living paycheck to paycheck, which is the majority of people, especially here in Alabama. And something else I wanted to add, you talked about the impact of folks on the ACA marketplace, but it's going to drive up costs for everyone else,
yes.
Right? And that's something that's worth emphasizing. Even if you have great health care through a great union contract, right, your employer is going to be taking more of a hit. And right. Next time you go to contract negotiations, better believe health care costs are going to be higher. And that's something you're going to have to wrestle with. And we've got a lot of jobs that are on the line, jobs in all sorts of industries beyond healthcare. We've seen a lot of the building trades losing jobs over the last several months. Mm-hmm. It's tough. It's tough what's going on. And I just really appreciate everyone who is trying to tell the truth about it.
Yeah, and the just to let people know, like, the mechanism by which that happens. Maybe you think, well, if somebody loses their health care because it costs too much on the marketplace and they opt not to keep paying that, and they just kind of drop out of the system, why would that then increase my health care? What does that have to do with me? And that has to do with you, because health insurance is a risk pool, okay? And we need young people, young people like me, right? I'm not on any medications. I have not had a surgery since I was like 18, and I had my appendix removed. And so I'm like very, very healthy, generally speaking. Obviously I could be in better shape, but on the whole, I'm like a generally healthy person, and I don't need a lot of health care. So you need people like me paying my insurance and, frankly, not getting a whole lot out of it. Or my employer paying insurance for me and not getting a whole lot out of it. Or people on the marketplace paying insurance and not getting a whole lot out of it. So that the risk is diluted. And you have people who are less healthy, who need more care, who can reap the benefits of everybody being in this risk pool together. If somebody like me, a young 29-year-old, I almost said 25, a young 29-year-old guy, if I was on the marketplace, and my employer wasn't paying for my health insurance, there's, in all likelihood, there's a world in which I decide to not get health insurance for a year or two to save myself money. Well, then you have just lost that low-risk person who's paying in and not getting out. And so you have to distribute among everybody else. Everybody else has to increase their, the thing that they're paying in by a small amount. And if you have 100,000 people, and those are going to be the people who are going to be the first to go, right? The most likely to drop their health insurance when it gets too expensive are the people who don't need it most often. And so you're going to increase healthcare costs for everybody because the healthiest will drop out of the system. And so that's how that's going to increase your healthy individuals.
Yeah, and I just want to put a number on it because there's 179 million people with employer-based insurance, right? So a lot of people, majority of people. AFL-CIO estimates that we will be looking at $485 more per person per year. So if that's a family of 4, that's nearly $2,000 a year. Which, given how expensive healthcare already is, the idea that it's going to go up even more, even if you are not directly impacted by Medicaid or the ACA, right? Even if you have some great Blue Cross plan in Alabama through your employer, you're looking at more expensive healthcare for everyone. And, it's just the thing that really weighs on me is how many folks are going to die because of this? Because people are going to miss out on preventative treatment. People are going to miss out on medications they need. People are going to show up with emergencies and have to be treated, as you pointed out, right? Whether anyone's paying for it or not.
Right.
And how many are going to show up too late? How many people are going to be buried too soon because of this? This is the richest country in the history of the world.
Right.
And this is what we're doing.
Somebody asked in the chat, should single healthy individuals receive Medicaid coverage if they refuse to work? And I just want to, before I answer that, I just want to say that is not what the debate is about.
No.
With the shutdown. That's not that, because the Republicans have already pushed through their, what they want to do with respect to work requirements. That's done. That's done and that's over. And so this is just about, actually funding Medicaid and funding the marketplace. The marketplace subsidies are really the big thing. And so that's separate from anything else that I'm about to say. But yes, everybody should get health insurance. We should have Medicare for all for everybody, and everybody should pay a little bit into taxes so that everybody can get health insurance, and so that we have to pay less ultimately, because if you have one single payer insurer, then that single payer can negotiate better for drug prices and bring drug prices lower, can bring medical costs lower. We pay the highest amount for healthcare in the world. Nobody else pays more for healthcare than we do in America, and we do not live longer. We do not have better care, generally speaking. We have some better things for cancers, but that's largely a result of research that is funded by the government. That's not, it's crazy. So yes, everybody should get healthcare. And then specifically, so I believe in Medicare for all. I believe that we should have single-payer life and health insurance, generally speaking. And then even more specifically, just on the Medicaid work requirement stuff, states have implemented work requirements for Medicaid, and the cost to administer those work requirements are more than the savings that you get from kicking off the 6 people who match the description of the 29-year-old person who doesn't, who's not working and just freeloading and living large on Medicaid, because Medicaid is not, you can't live on health insurance. How else are you going to, there's just so vanishingly few people that actually match that administering the work requirements, that takes labor. That takes administrative labor. And to do that, we have found in the states that have done it, costs more than the money that you save by kicking people off of Medicaid. And so it's just more fiscally conservative not to have these stupid work requirements. You save money and then you get people health care. And it's just crazy.
Maybe then they can go to work, right? If they're healthier.
Then they can go to work. Yes, maybe then they can go to work, because actually not having health care can prevent you from going to work, because if you don't have health care and you can't get your insulin and you can't get your whatever, then you become less able to produce and to labor. Okay, we got to take a break. You just saw a clip from the Valley Labor Report. We are live every Saturday morning from 9:30 a.m. till 12:30 p.m. And we pride ourselves on keeping all of our content free to everybody so that we can talk to as many working folks as possible. If you support the work that we're doing, you think that it's important, you think that it's good, then consider making a monthly contribution to the project, and you can do that on our website, tvlr.fm.